it is a proactive approach. We're not just sitting back and saying, if you have a heart attack one day, we'll deal with it. These days, I think that red meat is probably at the top of that list.
Hey carnivores, welcome back to the channel. I hope you all are having an amazing meat-fueled day, and as always, I'd love to know how you are doing on your carnivore journeys. Comment an update down below and let me know if you've celebrated any recent victories or if you're going through any current hurdles and struggles. In today's video, I invite on board-certified heart surgeon Dr. Philip Ovadia to answer some popular and controversial questions. Dr. Ovadia will be joining me live soon in my 30-day carnivore challenge, and he will be answering personal questions submitted by all the members. If you don't want to miss this live Q&A, you can sign up for my carnivore challenges at spgmeetup.com, shown on the screen, or click the links down below in the description box for more details. Let me welcome back Dr. Philip Ovadia. Hi, Dr. Ovadia. Welcome. How are you doing?
I am doing great. It's great to be here with you again, Bella, and good to see everyone in your community again.
One of the weirdest questions that I get a lot on my Instagram, TikTok, YouTube is, Bella, what do you think about the whole blood type thing? There's certain blood types that actually work better for carnivore. So is this fake or is there some truth to it?
I really am yet to see any evidence that suggests that to be true. At this point, and I know you'll agree with this, it's rare that someone can't do a carnivore diet or doesn't, can't do it well. And I certainly don't think blood type is an important differentiating factor there. Dietary preferences may come into play, and maybe there are some other things. And, we get into things like people, might need enzyme support or whatever to be able to implement a carnivore diet well. Some people need lower fat versus higher fat. There are all these things that you can get into, but ultimately I don't think blood type has any relationship to eating what I consider to be kind of a baseline, proper human diet. So
yeah. Curious, what is your blood type, Dr. Ovadia?
I am B positive.
Me too.
Really? Wow.
And Raymond?
O positive.
O positive. Emily?
I don't know.
You don't know? Okay.
Doesn't matter.
Okay.
Doesn't matter.
I love meat no matter what I am.
There you go. That's right. So I just wanted to share with you when I went to my doctor with my numbers, and they actually told me that I need to be on a low dose statin. And he actually said that just for my age alone, he would have done that, much less what my readings were. What would you say to that?
Yeah, so, there is some concerning data around statins and coronary calcification. And in fact, I would say the totality of the evidence suggests that people on statins tend to have increased coronary artery calcification and more rapid progression of their coronary calcification. Now, the general cardiology community sort of gets into this little bit of a backwards argument here, where they'll say that that's actually a good thing because the statins have taken what was probably soft plaque and converted it to calcified plaque, which is considered to be more stable and less likely to lead to a coronary event. But the overall, again, coronary calcium scores, we know the higher your score is, the more likely you are to have a clinical event. So it gets into, and when you point out that incongruity to them, they sort of, they get a little bit upset about that, honestly. It's just an inconvenient truth around statins. Again, I come back to, and this is where the blood work and the more detailed blood work becomes important, because certainly if someone has a high LDL cholesterol level and they have a lot of small, dense particles, they're insulin resistant, then, yes, there probably is some benefit to lowering cholesterol in that situation. But if someone like yourself, who's, corrected their metabolic health, they're not insulin resistant, you have a lot of large LDL particles and not a lot of small particles, then I just don't see any evidence that there's benefit to lowering your cholesterol in that situation. It's a very complex decision. This is really those situations that I tell people you got to be working with a practitioner who understands this stuff and can guide you through it. This is one of those questions, I get it all the time on social media, and I'm just like, I can't answer this on social media, and even in groups like this, this is where one-on-one work with a practitioner who's knowledgeable about all of this nuance is so important. And, ultimately, it really comes down to your decision. You as the patient, you're the one that decides whether or not you want to take this medication or not. And the doctor should be able to, present the evidence for and against it to you. So I would tell, what I would tell you if you were my patient is something along the lines of, statins have some benefit. Okay. It's not that they have zero benefit. It's not that no one should be taking statins. And the people that are most likely to benefit from statin therapy, one of the characteristics that goes into that is that you have significant coronary disease. You've had a heart attack, you've had a stent placed, you've had bypass surgery. Those are situations where statins have shown the most benefit. I would still make the argument that, the quality of your cholesterol matters a lot. And for someone that has good quality cholesterol, which comes from not being insulin resistant, I'm just not convinced that there's benefit to statins in those situations. But ultimately, this is a lot of what my practice focuses on. And I have some patients who take the statins and some patients who don't. And I work with both of them. One of the other situations that many people run into is, their doctor will be telling them you need to take a statin in this situation. And if you're not going to take a statin, I'm not going to be your doctor anymore. And I think that's ridiculous. And like I said, in my practice, I have patients in this situation that say, I'm going to take the statin. I want to take the safer approach, what's considered the safer approach by mainstream. And I have other people who say, I agree. I don't think I need the statin. And we continue to monitor them very closely. Again, I get CAC scans on a yearly basis on some patients so that we can keep a close eye on this. And, if things are going amiss, maybe we say, okay, for whatever reason, maybe we change course and maybe a statin becomes an answer. Maybe not. What it oftentimes tells me is there might be some other factor that we need to be looking for that's, driving the progression of your heart disease besides your cholesterol. And like I said, sometimes we get into other areas of testing for indolent infections and heavy metal toxicity and things like that can be contributing to this. It's really not about the amount of your cholesterol. It's about the quality of your cholesterol. And so triglyceride to HDL ratio is one of those indicators of the quality of our cholesterol. A couple of other markers, that I'll look at to help us figure out quality of cholesterol is the VLDL measurement. If you have a lab that doesn't report VLDL, there are two ways you can estimate it off of a basic cholesterol panel. Divide your triglycerides by 5 is going to be an estimate of your VLDL. And you can also calculate what's called remnant cholesterol, which is mostly VLDL. There's a little bit of other stuff in there, but it's a kind of good enough estimate for most purposes. And to calculate remnant cholesterol, you take your total cholesterol and then you subtract your HDL cholesterol and then you subtract your LDL cholesterol. And what's left over is what's considered your remnant cholesterol.
So in our groups and with our folks that are coming for support, they're wanting to know what are the absolute best foods that they can have to prevent heart attacks and heart disease.
Yeah, these days I think that red meat is probably at the top of that list. Coenzyme Q10, things like vitamin K2. These are some of the key things that help to slow the progression of heart disease, and ultimately reversing insulin resistance is the most important thing. I see that done most consistently with high protein, low carbohydrate dietary approaches.
Which foods are going to ruin your heart health? Number one, sugar. Any type of sugar, especially refined sugar, is probably the worst, most damaging and detrimental food you could possibly put in your body. The second food, seed oils. What are seed oils? Seed oils include sunflower oil, grapeseed oil, canola oil. I'll put a whole list of seed oils. The reason why seed oils are so dangerous is because it promotes inflammation. Seed oils are extremely high in omega-6s, which causes it to be so inflammatory. Seed oils are a highly processed product. It requires high heat and so many chemicals to even be created. And on top of that, it is rancid and oxidized. Third and last category of foods, anything fried foods in general. Now this encompasses so many different types of food. Anything that is deep fried in seed oils. Okay, so that's like a double whammy. Not only do you get this terrible food, you also dip it in even higher heated and rancid and oxidized seed oils. And these foods are most likely filled with tons of gluten and starch. If you are concerned about your heart health and your doctor has already given you that talk where he or she recommends you statins, there is a way to make your heart healthy again, to improve your blood work by cutting out the deadly, dangerous foods and eating the right foods.
For more about lab work analysis and understanding carnivore lab work, I filmed a separate video with Dr. Ovadia where he analyzes all 3 of our carnivore lab work. It is such a wealth of information, and he teaches us how to understand these numbers. I have linked the video down below in the description box.
Now, in this second half of the video, I actually feature some of my own member questions that Dr. Ovadia tackled. Dr. Ovadia will be visiting us this month in my current carnivore challenge, so if you don't want to miss his upcoming live Q&A, you can still sign up at the link shown on the screen, sbgmeetup.com, or you can click the links down below in the description box for more details. So our first question is from Cynthia, and she says, as a new carnivore with elevated triglycerides and cholesterol, I'm naturally concerned about all the meat and fat. I know that this is not the case and that inflammation was more likely the culprit, but I still worry about it. My blood pressure has returned to normal after only 2 weeks, partial carnivore, and now several days of full carnivore. My abnormal labs were from summer 2021, and I have not had them rechecked. Would it be a good idea to do so in the next few months?
Yeah, great question. And I'll just, kind of remind everyone that in a forum such as this, I'm not giving specific medical advice, but, I kind of talk in generalities. The whole issue around cholesterol, what I hope people can come to understand is that the way that cholesterol is addressed by the, healthcare system in general, I guess I'd say the mainstream healthcare practitioners, is incomplete. And, for most practitioners, their view on cholesterol is very narrow, and it only looks at one number, the LDL, the so-called bad cholesterol. And if that number is above a certain threshold, then they believe it needs to be lowered. And but that is a very incomplete picture because it doesn't take into consideration, the environment that the cholesterol is in. We need to understand that cholesterol is a basic building block of our bodies. It is essential to life. Without cholesterol, life wouldn't begin. And if you somehow magically sucked all the cholesterol out of your body, you would die right away, because cholesterol plays a number of vital roles in our body. So I do not believe that it should be, just lower the cholesterol. I think we need to consider the context that cholesterol exists in. And, other blood work can help us to understand this. One of the, I think, most important numbers to be looking at, one of the concepts I talk about in my book is figuring out if you are metabolically healthy or not. And 2 of the 5 numbers that we look at to determine metabolic health are from a blood cholesterol panel. But neither one of those numbers is your LDL cholesterol. It is your triglycerides, which were mentioned in the question, and it is your HDL, your good cholesterol. And specifically, I think one of the most useful numbers to look at is the ratio between your triglycerides and your HDL cholesterol. So if you divide your triglycerides by your HDL cholesterol, that ratio ideally should be under 2, as close to 1 as possible. And again, if I'm not sure if anyone is outside of the US in this audience, you need to use the US units for doing that ratio, milligrams per deciliter. The conversion from millimole is different, so the ratio changes. But basically what that reflects is if your triglycerides divided by your HDL are less than 2, there's a very good chance that you are not insulin resistant and you are in good metabolic health. And again, when we look at the data around cholesterol, what we see is that if your triglycerides are low and your HDL is high, it probably does not matter what your LDL cholesterol is. And I know that's, a very nuanced kind of discussion, so again, I'm not saying ignore your cholesterol level. What I'm saying is you need to consider the context of your cholesterol. You need to work with a good practitioner who understands these nuances, can go beyond the basic, 1 number regarding your cholesterol. And oftentimes, it involves doing advanced blood work, advanced lipid panels, other things like that. The other part of the question was about frequency of checking these things. And, the person who asked the question said those numbers were, summer of 2021, so over a year old. And I do believe these numbers should be checked at least on a yearly basis. With many of my patients, I check it many times a year, like every 3 to 4 months, especially if you're actively making changes, in your diet, if you're losing weight, if your health is changing, then you want to be rechecking these numbers to know where you are today, because it may not reflect, where you were a year or a year and a half ago if you've made significant changes during that time.
Our next question is from member Stacy. Why does my heart beat so hard and fast after eating? It never did that before going carnivore. Do you think it'll stop doing that once I'm completely acclimated to this way of eating? I'm 4 weeks in from being vegan for 10 years.
Congratulations on making that change. It sounds like basically you're having a bit of a, I guess we should say, stress response to the change in the way you're eating. Cortisol, epinephrine, these are some of our stress hormones that can cause our heart to beat faster and harder. That it may just be that, because you've sort of completely shifted your way of eating, your body is still adjusting from this. And my guess is that it will, it is something that will resolve with time. But if it doesn't, I think it's certainly something that needs to be looked into further. Again, finding a good physician to work with on this issue. But if it's something that, only lasts a short period of time and it's right after you eat, then, I would say just give it some more time and it's highly likely that it will settle down as your body acclimates.
If you can relate to this question and are also having heart palpitations, fatigue, headaches, This could be a sign of electrolyte imbalance. Salting heavier on all of your carnivore meals could easily fix these symptoms. But if that is not enough, a high quality electrolyte supplement can come in handy. And the brand that I always recommend is this one called Element. It is spelled out as LMNT. And this specific colored box, the teal colored box, is labeled raw unflavored. There's no stevia, no flavorings or extra ingredients besides the 3 electrolytes that our body needs. This is what the packets look like. Super easy to just throw in your work bag, travel bag, take it on the go. You just rip a packet open, pour it in whatever beverage you're drinking, mix it up, drink it down, and you are good to go. Having electrolytes really matters on how active you are as well. So if you're very active, go to the gym, sweat a lot, you may need more than 1 packet per day. You all can get a free sample pack like this with any purchase if you go to the URL shown on the screen, drinklmnt.com/SBGAL. I have also linked it down below in the description box. This next question is from our member, Amber. She says, "Hi, Dr. Ovadia. My grandfather, uncle, and aunt all died from congestive heart failure. Is it true that I am at risk of the same heart disease issues as well?"
In terms of genetics, what I always tell people about genetics is genetics are not destiny. Yes, you may have a predisposition. You may have a higher risk of, whether it's heart failure or some other disease based on your genetics, but that doesn't mean that you are, these aren't truly genetic conditions, which there are. There are truly genetic conditions that if you have, a certain gene mutation, that is defining of a disease because of whatever effect that gene mutation has. Heart disease does not fall into that category. I always sort of estimate with people that, perhaps 5, maybe 10% of your risk comes from your genes, but the vast majority of your risk comes from your habits. And this is one of the reasons, for instance, that, things like heart disease seem to run in families, because not only do families tend to share genetics, families also tend to share their habits. You eat the same foods that your parents ate, and you have the same habits oftentimes that your parents have. So never think of genetics, as a, sort of a sentence, as a death sentence. And so I think within whatever, your risk window is, having better habits is always going to improve things. And carnivore diet is certainly part of that. In terms of sort of transitioning to, again, to the carnivore diet from paleo, drinking, not working out, all of these things are, of course, going to have, negative effects on your health. And, while I think diet is probably the most important thing, it's not the only thing, that ends up determining your risk and your health. And so you do want to be paying attention to, other things like that. And, getting back into, HIIT workouts. First of all, I would tell you that, I am not convinced that, the HIIT workouts, are the most important type of work to be doing when it comes to exercise. I always advise people that building and maintaining muscle is the most important thing when it comes to your metabolic health. So I would focus on that. But, like I would advise pretty much anyone who has been inactive and is now trying to get active again, just do it gradually, just start where you are, start with what you can tolerate, and then push yourself a little bit further, each day, each week. And before you know it, you'll be back to, your previous level of activity.
Next question is from member Ileana. She says, "My primary doctor recommended me to take TED yeast rice with CoQ10 and niacin 200 milligrams because my cholesterol was high. Do you recommend to take this supplement? Which brand is good to take that does not have the red yeast rice?"
Yeah, so, I think of supplements in much of the same way that I think of medication. And, so you should have a purpose for taking that supplement. So, in this specific situation, they are recommending these things because your cholesterol is high. And so we go back to sort of the earlier questions, and we need to figure out, is having high cholesterol problematic or is it not? Because if it's not problematic, then there's no reason to lower it, whether you're doing that with supplements or prescription medications. All of these supplements that were mentioned, at least have a little bit of evidence that maybe they can lower cholesterol levels. But again, I step back and say, why are we trying to lower your cholesterol level? What do we think the benefit of that is going to be? And so that would be the question that I answer first, before deciding, which, if any of these supplements are useful. In terms of brands, I don't, typically recommend specific brands of supplements. I do caution people that, if you are going to take a supplement, you want to be able to judge the effect of that supplement. So, whether that's maybe a blood test or something else that can tell you that that supplement is working or not working for you. And you do want to look for supplements that are, kind of high quality, and that doesn't necessarily maybe come to a specific brand. It just, like anything else, if you're ordering it off of Amazon, you may or may not be getting, what you think you're getting. And so you want to be careful about your sourcing of supplements. This is, again, working with physicians. Physicians oftentimes will have access to, brands that are vetted in some manner. Offhand, like I said, I don't really have a red yeast rice recommendation. It's not a supplement I typically use with my patients, because again, is it going to help you? Is lowering your cholesterol going to be beneficial? Is the first question that I would be trying to answer in this situation.
This next question is from member Jill. Hi, Dr. Ovadia. My blood pressure has always been on the low end of normal, but since being carnivore for 7 months, it is now staying around 85/60. Is this too low? Is there a certain point where I should be concerned? Thanks.
Yeah, so, too low blood pressure can be a concern. And really the test of, is it a concern for you, is, are you having any symptoms of low blood pressure? And the typical symptoms of low blood pressure are going to be, things like getting dizzy, getting lightheaded, passing out. Those are the things that I would be looking out for. If you're not having any of those problems, then, low blood pressure, whatever the particular number is, probably doesn't need to be a concern for you.
Dr. Ovadia will be visiting us this month in my current Carnivore Challenge. So if you don't want to miss his upcoming live Q&A, you can still sign up at the link shown on the screen, sbgmeetup.com, or you can click the links down below in the description box for more details. Thank you again for watching. If you enjoyed this video, please don't forget to hit like and make sure you're subscribed to my channel. Turn on those bell notifications if you don't want to miss any of my future new videos. I'm now 5 years into the carnivore diet, and I cannot believe to this day some of the benefits and healing that I have seen and felt. I just stick to what I love eating carnivore-wise and what I know makes me feel amazing. Something that I have been incorporating in addition to eating well is wearing blue blockers. So these are the blue blockers that I wear every single day. I also have a third one, the red colored version. So I wear these all throughout the morning and daytime when I'm doing Zoom calls, filming on devices. This yellow one goes on right when it starts getting dim outside. And the red one I wear the moment it's dark outside, and I wear it all throughout the night. I will make sure to link them down below. Something else that I have been using is Bon Charge's sauna blanket. This is totally an investment. I have it set up, plugged in my apartment here in Seattle, because the entire inside of that blanket is wrapped with sauna light. So you get the healing benefits and the biohacking benefits of being completely surrounded by that sauna light therapy. So it's incredibly warm and comforting after a long day outside. And Steak and Butter Guy loves using it right after his workouts, right after coming back from the gym, so he doesn't have to deal with any type of soreness from his workouts. If you're interested, I'll make sure to link them down below in the description box. You all can connect with me even more on all the platforms, all at Steak and Butter Gal, Instagram, Facebook, TikTok, Threads, Twitter. All of my platforms and links are also down below. Enjoy the rest of your day, and I will see you in my next video. SVG out.